Hi, my name is Kelly Lavin, and I want to welcome everyone to our second annual now virtual panel discussion in honor of Pregnancy and Infant Loss Remembrance Day. I co-chair our Palliative Care and Bereavement Committee here at Barnabas, and I just would like to welcome everyone here. Erin?
Thanks, Kelly. We're just thrilled to be here again this year with all of you. I'm Erin Truxillo with Pockets of Light. Pockets of Light offers peer support to parents that have lost a baby during pregnancy or shortly after birth. We've been offering support now for about 9 years, and we also offer perinatal loss trainings to healthcare providers and graduate students. And make donations to hospitals as well. So, we're just here to help support, the community and make sure everybody, the healthcare providers have the tools they need to make sure they can support their patients. So I think that this panel is, Kelly kind of reached out about this panel, last year and last year was the first one. The feedback we received was amazing. And I think it's really unique to have a panel of healthcare providers and bereaved parents, sharing together and learning from each other. And I just think this is beneficial to everyone, that's listening. So thank you all for participating. We're going to get started. We're going to have each of our panelists introduce themselves. We'll start with the healthcare providers. If you could each, just share your title and kind of your experience working with lost patients, we can start there.
I can start us off. My name is Kat. I'm one of the registered nurses at Barnabas. I am super honored to be here and contribute to a conversation so powerful and important. So thank you. And I appreciate everyone sharing their stories in advance because every piece of experience, expertise really helps me grow as a nurse and as a human. So thank you. My experience supporting families during the initial periods of their loss differs each time, which I think is where the value comes from. I've learned that each family grieves very differently, and to allow the space for that can be difficult, but is extremely important. I've been the primary nurse in 5 perinatal losses that I always will carry with me. I remember each and every family, each and every baby. And I try to remember that we can't always control when a loss happens, but we can control how the system responds. And I'm really proud to be able to contribute to that. So thank you for having me.
I'm Chloe Phillips. I am an OBGYN who has privileges at Barnabas. I am in private practice in the area as well. And I also want to just thank everyone's strength and bravery from being here and listening to sharing whatever everyone's comfort level is, and just happy to be a part of the conversation so that we can continue, because we do need this to certainly be a conversation, a two-way between and it's often not just two-way, but all the multiple parties that are involved when a loss occurs. I will say I do get, I think, a unique perspective too, and being in the office setting too. Loss really starts from the moment someone knows that they're pregnant, and that pregnancy does not end in a baby. So we see that even with chemical pregnancies and first trimester miscarriages, but of course the ones that land us in the inpatient side in the hospital as the pregnancy progresses. But it's certainly a spectrum, and as Kat said, everyone handles differently, and so we're just hoping to be as much of a support as we can to all those experiences.
My name is Caroline. I'm the social worker at Barnabas. I cover the antepartum unit, labor and delivery, as well as the neonatal intensive care unit. I'm going into my 5th year here, and I support parents and family members who have a loss from during the pregnancy. I see people who come into the emergency room or come into the OR for a procedure, up until people who lose a child up until a year of life or after. But my primary units are labor and delivery, antepartum, and the NICU. I would say, unfortunately, I am supporting families with a loss several times a month, upwards sometimes of 10 families a month that have a loss during pregnancy or shortly after. I'm honored to be a part of this panel again. It was really wonderful last year, and I would say over my 5 years here, I have learned the most from working with parents who have gone through a loss, because I can empathize with you and support you, but I've never been in your shoes, and the feedback that we receive from parents is really the best way to learn. I currently have a set of parents right now who have a baby in the NICU who will be going home soon, and they've really felt so much support and love and benefited from Pockets of Light, and hearing their feedback about, working with you guys, but also things that we did for them when they were here, things we could have done differently and what helped. I feel like that's really the best feedback for us. So I appreciate everyone participating in this.
Thank you all. So now we're gonna have our parents each tell their loss story. I think we're gonna start with Alex and Melissa.
Okay.
All right. Hi, we're Melissa and Alex DeMeo. We were pregnant with our twins, Magnolia and Penelope, up until about 35 and a half weeks when we realized we had lost them. And it was a long road to get to our girls. We had had 3 miscarriages before that, 2 failed IUIs. And then, we're so blessed to get our baby, or what we found out at week 9 was babies. And getting to them seemed pretty effortless. Everything was, we were checking all the boxes. Everything looked good. They were healthy. There was no issues or problems with the girls. And about at 30 weeks, I started to feel just a lot of itchiness in my palms and on my legs. And I kept saying, I think it's cholestasis. And that's it, cholestasis. Right?
Mhm.
And none of my blood work or anything came back showing that it was. And I don't know if it was that. I don't know if it was just, the luck of the draw, but I went to my doctor's appointment at my 35th week, and my doctor told me that there was no heartbeat, and that was it. And, she was amazing and took such good care of me and brought me to the hospital, because I don't even know how I was. I just knew that they were gone. And my husband was working that day, and he was in the city, and it took him like an hour and a half to get to me, and he had to stop home to feed our crazy dog first and take her for a walk before he could come to me at the hospital, because she won't go to anyone else. And and it took a really long time, and I wish we knew that it was going to take so long to deliver the girls, and we did, and we were there for 3 days. And when we did deliver them, the doctor did show us that they had tangled their cord into a knot, and that's from what we understand, the cause of their fetal demise. And yeah, that was
Yeah.
October 7th, 2021. So
4 years ago.
it
Bet.
was.
And we've been very thankful of Pockets of Light, and joining these panels helps us with our remembering our daughters and our continued healing. So thank you for everyone for letting us be a part of this.
Yeah.
Gigi, do you want to go? You want me to go?
Sorry, I was just trying to figure out how to unmute. I don't know what was going on. Okay. Hi guys, I'm Gigi Jahan, by birth Jahan Reed. My husband and I lost our first son, Avery, in 2019 by stillbirth at 37 weeks. There was nothing wrong with the pregnancy up until that point. We too had an umbilical cord accident that we found out after we had to deliver him. We both came into the marriage with daughters, and then we had a daughter together. So it was a real shock to us. We were really excited about our first son. Both sides of the family were very excited about the first grandson. And so this was something that really hit us hard, hit our families hard. And Pockets of Life really saved us, because the connection, not only just getting the support through the grief, but also getting the support of other families that have gone through what we've gone through and experienced it and have had different stories. And it just keeps you kind of in the space where, you realize you have to move on and live, but someone understands why it's so hard. And this is important for me to be able to participate. I'm so sorry, I hear a screaming child in the background. I'm going to get through this quick. It's important for me to participate in panels like this because we had a really great hospital experience. And I want to make sure that the things that happened for us that made the difference, that we share, or at least I share on our behalf, so that this can continue in other facilities. So thank you.
So, hi, I'm Tom Truxillo. It's not a coincidence that I have the same last name as our facilitator here. I'm Aaron's husband, and I'm also a facilitator through Pockets of Light. But this is much more difficult than running group sessions, talking about our loss and our story rather than helping others. So I'm going to try to get through this. Aaron and I lost our first daughter, Haley Janelle Truxillo, on November 26, 2008. Yep, 17 years ago. And that loss still has a daily impact on my life. After years of struggling with infertility, Aaron was able to get pregnant through IVF. And we were kind of on top of the world. We thought we had gotten through the hardest thing that we would ever go through, and that, life's plan was going to unveil itself as it should from that point on. And for the first, 35 and a half weeks of the pregnancy, that was true. The pregnancy was relatively uneventful from a medical perspective. Haley was growing and developing as she should. We were having a wonderful time kind of nesting and preparing to bring our little princess home. And then the day before Thanksgiving, we were, preparing to host family. We were kind of alone in Charlotte, and we were preparing to host family that was coming into town to visit us, given Aaron's pregnancy. And Aaron's water broke, and we noticed that there was blood in the fluid. So we got in the car and got to the doctor's office as fast as we could. And while in the doctor's office, Aaron lost a little bit more blood. And the nurses were able to find a slight heartbeat. So they rushed us across into the next building, the hospital. The doctor's office connected to the hospital. So they rushed us over to the hospital. And after a couple failed attempts by nurses to find a heartbeat, they called a doctor in with an ultrasound machine who did find a slight heartbeat. And they're, called for an emergency C-section. And obviously, all bereaved parents stillbirth parents at least will say, like, when you don't hear that heartbeat, when you can't find it, that it's like the loudest silence in the world, right? And so me not being able to hear a heartbeat, and then the commotion that followed with Aaron, everyone going into a panic and rushing her out of the room we were in into the operating room was pretty intense, to say the least. Obviously, the reason we're on the panel is because Haley did not survive. She was born still due to a condition called vasoprevia. We have had we've been fortunate enough to bring home and raise 2 children since, and they are aware of their older sister. She is a big part of our life, and always will be. And this day, still 17 years later, is still extremely hard to talk about. But it's important to do it for all the reasons that all of you have already said. We did have a relatively good experience, given how terrible the experience was from our medical providers. were very empathetic and treated us extremely well for the most part. And we do have some lessons learned to share as well, to try to make sure that, kind of the same mistakes aren't made. But this is extremely important to do, to have us all together and share this, and make sure that we're, treating bereaved parents with the best care we can possibly give them.
Okay, well, thank you all for sharing your stories with us. So I'm going to ask a series of questions to our panelists. Some are going to be towards the grieving parents, and some will be for the healthcare providers. And then if anyone else on the panel has, something they'd like to add, to the question, feel free. So we're going to start off with a question for two of our parents, Melissa and Alex. What did you find to be the most helpful thing said or done for you in the hospital after your loss?
Sure. Hello. So I would have to say the transparency from the medical professionals that were tending to Melissa and myself in a way. We were obviously in shock. We had a really hard time understanding the reality of it. And we really didn't, there wasn't even a possibility in our mind. We never heard the phrase, of stillborn until I think the last appointment we went to, and they just happened to mention it because we asked why we were going to have
Very off the cuff.
a scheduled C-section at 36 weeks, and they said, "Oh, just because your chances of stillbirth increase after then." We're like, "Oh, okay." Still didn't think anything of it. We're back to the hospital. We were a little bit in shock. Melissa was on her phone trying to cancel items that were coming to the house. And I was thinking about taking down some of the monogram stuff that were in the house, so we had everything decorated. But the medical professionals told us, you really have to think about your health, your mental health, and the trauma that you're going through. Aside from Melissa taking care of her physical needs, this is really going to be rough ahead of you. You're going to have to make a choice if you want to have a funeral, if you want to have cremation, if you want to cut the cord. And these all fast reality coming at us, but it was done really tactfully. And they did tell us, once you leave this hospital, you have to start working on yourself and repairing yourself right away. And it was really important because we did that right away. We got the brochure for Pockets of Light, and when Melissa was able to connect with Erin and encouraging us and being transparent and letting us know that it's going to be a long road, but there's light at the end of the tunnel. There are other people that have been in your shoes, and that we could possibly have children later, and we do. We have a 2-year-old now. So, but the transparency was key.
And then for me, I kind of mentioned it already, but my doctor stayed with me. She drove me to the hospital and waited that hour and a half that I waited for him to get to me. She sat with me, and, she didn't stay exclusively in the room with me. She would go and check in on other patients, I'm sure, throughout the hospital, but she kept coming back just to make sure I was okay. And, throughout that, 36 hours of laboring and getting to our delivery, the doctors would come in and they would talk to us. And you remember the doctors that look you in the eye and are speaking directly to you, and you remember when they can't because it hurts them. And I think that's a big piece of it too, is that, you're so wrapped up in you forget that, that hurts them as well. And I remember, and she says it to me every time I see her, my doctor said, I know that was the worst day of your life. She's like, I want you to know it's one of the worst days of mine. And I think that that's always just held really close to my heart, because it's really, it should have an effect on you, and you should care as much as, not as much, but you should care with your whole heart that you're, seeing someone through the worst of their time.
Yeah.
Thank you too. So the next question is for Catherine and Chloe. What are some special ways you and your staff support and care for your lost patients?
I think just echoing off something that Melissa just mentioned, like I think we are in some ways trained to kind of like you're the guiding force and you're supposed to be the one holding it together, and maybe even sometimes straying away from emotion or showing your own emotions, but that in these situations, I think it's just as important to show your true emotions as a human being, and that like it's absolutely true. Like we also carry these moments, even though they're not our moments, but they're like flashbulb memories. They're things that I can't unremember, and it's sometimes the smallest thing. About a patient's story or what happened, but that, yeah, like I sit next to the bedside and I'll cry with patients, and it's not something I often do, and it does make me feel uncomfortable because I am thinking like, oh, I'm supposed to be the one who's keeping it together, but it's not a, sometimes there's just no words, and I struggle to read the people that might find comfort in that, and then those that maybe don't and do want that kind of like guiding force that's like, I've got this and I'm going to take charge of the ship here and make sure that while the world is crashing down, that we're holding firm over here, and we're still doing that even if we're showing emotion. But I think on top of that, just like meeting patients where they are, whatever their needs may be, giving space when space is needed, trying to maintain consistency of the faces in the room. We are at an institution where there's a lot of learners, both in nurses and physicians and all other levels of healthcare providers, but really trying to, when we can, make it such that it's the same faces and people that are in the room, and minimizing excess traffic, just to not have to be another person that you have to maybe explain or even interact with.
I agree. And Chloe and I have had discussions about this because it is difficult at our hospital to navigate that. But I think that as a nurse, the cornerstone of what we've always learned ever since nursing school is to create a therapeutic space for your patient. And that changes based on who they are and who's with them. But making them feel human and making you guys feel like more than just a patient in that moment. We try to minimize those new faces because it can, I imagine, be painful to restate your wishes multiple times. And it's definitely difficult to navigate whether to be silent and allow for that space or to communicate. But I think that creating that therapeutic space and making people feel human, especially as a nurse, has been how we can make it more special for families, whether it be opening the blinds, getting a tray from downstairs with coffee, tea, some snacks, even though you may not want to eat them, and honoring our time, allowing you as long or as short as you want. People have left the hospital very soon after delivery or very long after delivery, and to allow for that and just to flex for what's best for the family, I think is really important. Caroline and the chaplain team and the social work team all contribute. They're such great resources for us, and I think integrating as a whole team can be very impactful for families as well.
Thank you both. Yeah, I mean, the continuity of nurses and everyone coming in and out of the room is so important. And I'm so glad you guys said that, because we hear that a lot. And I mean, that's part of like what we talk about when we go, talk to healthcare providers and students about how important that is. Because it's such an overwhelming experience for parents as it is. So anything you can do to minimize, the unknown, like the person that walks in that doesn't know what's going on, the better. So the next question is for Melissa and Gigi. What is one thing that you wish one thing that you wish had been done differently in the hospital?
I can start. For me, it wasn't so much on the side of the hospital as much it was something I just wasn't aware would have been important to me, like now, right? Some years later. Two things specifically is, and I was jealous of it in our support groups because some of the other families explained, oh, I kept the hat, I kept his onesie he had on, I kept the socks. Those things for me would have been nice to have, just because maybe it would have kept the scent of him a little longer. And then I would have had those little items in our memory box. So I didn't have any specific things that he was wearing when we had him. And then the second thing is something that's just been in the most recent years. My daughter Jordan was 2 at the time that we lost him. So now that she's 9, she's saying things like, oh, I wish I met him. I wish I was there to see what he looked like or to hold him. And of course, in the moment, you're thinking, oh, kind of cringe. Do you want to introduce your stillborn baby to the big sister? You know, I wasn't even thinking that was something that would have made an impact. But now that she's older, I thought, I wish I kind of had that idea, or maybe that would have been something that would have been, hey, have you thought about your living children perhaps coming and things like that? Because she is so connected to the story of her little brother, Avery, or she remembers every year she's planning, what are we doing this year for his birthday? What's going to happen? So that's a part, I guess, for her that I didn't consider really her in that moment, because of course, the rush of everything, like you guys mentioned, Melissa and Alex, about we got to focus on in that moment what's happening. But that would have been something that I wish someone would have maybe just suggested or as an option.
If I can follow on real quick, and for the healthcare providers, I mean, I know you all have processes and procedures that you have to follow, but you know, through the hundreds of bereaved parents we've talked to, right? We've never heard anyone say, "Oh, I spent too much time with my child after they passed." Like no one's ever said that, or no one said, "Oh, I held my child and I wish I didn't." You know, and so these things that like Gigi's talking about, introducing the older sibling, that in her words, right, it's kind of cringe, right? It's we're in shock, right? Like Alex said earlier, our mind's not necessarily working right. We don't realize like that moment in the hospital, that day or 2 days, are the only memories we'll ever get. We're not thinking about making memories at the time. We're thinking about what we're missing out on in the future. But you know, suggesting making memories, even if they're denied at first, suggesting again, you know, pushing that a little bit. I know you can't, I know there are rules about making someone do something, but continuing to suggest something, it's like, we've never heard anyone say, oh, I just did too much at the hospital, and it was too painful.
I think that feedback is super important, especially with the siblings. I feel like a lot of times if there's older siblings, I try to ask about, you know, were they aware of the pregnancy, or were they looking forward to a little brother or sister, kind of gauge like how much they know. I would say oftentimes, I mean, sometimes we have siblings who are in their 20s, but most often the parents who I'm meeting have siblings who are maybe 2, 3, 4 years old, and they say, oh, they're too young, they wouldn't understand. And I try to encourage them to, you know, talk with the older siblings about it, or, you know, if grandma's with them or grandpa or family friend, you know, even if they are not ready for the child to see the baby, kind of talk with them through it. And we utilize like our child life team here for that. And, you know, personal story, but I was with my mom when I was at her OBGYN appointment when I was 3 years old, and they couldn't find the heartbeat, you know, during her pregnancy. And I remember that to this day. So when people tell me, oh, you know, they're 3 years old, they won't remember it, I try to really encourage them to have those conversations and utilize the resources, because I think that's one thing that when you're so focused on the baby in that current situation, that, you know, thinking about the kids at home and explaining that to them, that they're going to grieve too, and they're going to grieve with parents. And if you're not communicating that with them, things are going to, you know, get worse. And especially 2, 3 years old, they're going to act out at daycare and preschool. And I think incorporating them in that grieving process is really important. And I appreciate that feedback.
And I would say the same thing that Gigi said and Tom. I think it's the things that we didn't do in the room with the girls. Like we held them at first, but then I didn't know if we could hold them again. So they just stayed in their cuddle cot the whole time. I didn't know if that was allowed. I didn't know that, some people get to like put them in their own clothes or wash them and read them, like have their books to read to them. Like if somebody would have said, why don't next time your husband goes home, tell him to grab books so that you guys can read to them. We played music for them because we're big music people. Like we played them our wedding song and things like that. So it was just like we thought of certain things instinctually and then we kind of didn't think about it at all. And the same with even just having, our parents come. Like we didn't know one that they were invited, I guess, because it was still like within the COVID guidelines where they wouldn't have been allowed to come.
Yeah.
And, that morning, our one nurse was like, what about your parents? Do you want to invite your parents? And I was like, invite them. This isn't happy. I didn't understand. But, my mom and my dad and my sister did come. And I just wish we had like, I wish there was more time with them.
Yeah.
And I wish we knew what else we could have done with them. So I think even if there's just a couple additional pamphlets that say like, these are what other bereaved parents have done. Like, if you want, we can make a checklist for you of things that you're yes, no, and maybe. And maybe I can come back to your maybes like on the next day and say, do you want to, is mom a maybe? Do you want your mom here? Or whatever it might be.
Yeah.
I like that, Melissa, the checklist. I mean, that's such a good idea. Because you don't always, I mean, I know I was, I didn't want to hold my daughter at first. I didn't know that was something that people did and that I should do. And, so you're right. You're scared at first, and being offered all of those options it's so important.
I think it can be difficult, as I think it was Chloe or maybe Caroline said this earlier, to read what a patient or a family member needs from you. And there are certain scenarios where, just as one of the bereaved parents mentioned, there's a lot of decisions all at once. You're asked, do you have to do a funeral? Do you want to do footprints? Do you want to do this? And if you're rushed, that's not going to feel good. And I think when it comes to, we can be very experienced with our medical decisions and making those decisions quickly. But when it comes to the interpersonal, emotional weight of these situations, sometimes there's no right way to react. And I think that's where you guys come in, because I'm sure in your own way, maybe very different from this scenario, but in your own way, you had your own anger that maybe was received wrong from a medical professional. I know sometimes someone says something to me to quickly shut it down, and it feels hurtful, but then later they're like, I'm so sorry, I was snappy because I'm sad about my child. So I think there's a level of, what do we do in this situation? How do we help people when they're facing this unimaginable situation?
And I think also from our standpoint, something that was mentioned as well, and I can't speak to all the details because I wasn't there for that case, but the transparency and part of care that we provide for death and dying patients, including our perinatal loss patients. And so, like wrapping the baby up and explaining to the parents, if mom didn't sound like she was in a medical state or capacity to necessarily hear or respond, but saying like, you're going to see the baby taking what looks like breaths, but we have tried X, interventions and things, and this is what we see in people who are in this stage and going to pass away, and it seems unnatural, and that there's more to do, but we've done X, Y, or Z and exhausted all of our options. And even still, that may not have not change any of the outcome. And then meeting them where they are and and understanding that reaction is going to be different for everyone.
Yeah, thank you for sharing that. I mean, that's obviously very, very unusual experience, I'm sure, for you all, and just the intensity in the room. I imagine that was just difficult for everyone. And kind of this, like you said, one of those situations where what can you do? But we certainly appreciate the fact that you all are sharing it and talking about it. And like you said, like you guys seeing, experiences from the bereaved parent side, but also us hearing about it from your side is really beneficial. So, so the next question is for our non-birthing partners, Alex and Tom. Did you feel acknowledged after your loss? And if not, what could have been done differently?
I'll go first. I did. Just obviously, my main concern was Melissa's health. So just the mere fact that people were asking me how I was doing, was really meant a lot. That someone was actually considering me, because I wasn't even considering myself. As I'm asked this question, we've done this question on a couple of panels. I go back to that day, and I was really angry. We had a lot of emotions. I know Melissa kept on asking why, what did I do wrong? She had guilt. And I, stereotypical non-birthing parent, I'm thinking, well, I'm the protector. I didn't protect my family. I'm losing my family. There's nothing that I can do. Everything is out of my control. And as I would go in and out of the unit, or the cafeteria, whatever, when I would leave, everyone in the hallway, "See you later, Dad." And I come back, "How you doing, Dad?" It took a lot in me to just be like, I'm not a father. Like, do you know what I'm going through? And I'm hearing all the babies being born in the unit. But then when I get back in the room, and someone, she was in like the restroom, and the nurse asked, like, "How you doing? How you holding up?" It kind of level setted me. It's just the fact that someone considered me, because Melissa was going through a lot. So in those terms, just the consideration. So I would say yes. Aside from being called Dad, but I understand that's like nice gesture. So, and I'm sure most of the fathers there really appreciate that. But just the consideration means a lot.
Yeah, I think that the reason Alex and I do a lot of these panels together is that we're good, kind of yin and yang, or opposite sides of the spectrum here. So for me, I didn't feel noticed or cared for at all. I think obviously, like Alex said, my primary focus was on Erin and Haley. But when she was taken for her emergency C-section, I was, there was a mass of people that went out with her, and I was kind of left by myself right outside. Like, didn't know, where am I even supposed to stand? I don't know what's going on. I don't even know where to go. With no explanation of, we've talked about transparency a lot here. No explanation of what's going on. What is an emergency C-section, and what does that mean, and what's happening? No understanding of how long it was going to take. No anything. And so I was standing out by myself for a while. Tried to make some phone calls to talk to my family members, but couldn't even speak right clearly. I didn't know what to say. A nurse finally did come out of the operating room, saw me looking, and what I'm sure was like completely lost, and offered to bring me into another room where I could sit by myself and away from other people, I guess. But didn't really offer any. I asked, what's going on? Can you update me? Can you tell me anything? And she couldn't say anything. And so, that was during the, height of the confusion, I guess. And I can understand that part almost. You almost want all of the medical professionals that can possibly help to go help, right? And to go take care of of mom and baby. But after the fact, the pregnancy loss is kind of it is a woman's health issue, and we all understand that. But after there's a loss, that becomes a mental health issue, right? And we lose our babies too. And Alex got checked in on. I didn't feel that at all. I got the how is mom doing? I got the questions asking about mom and not about myself. And we've already talked a lot about all the things, the decisions that need to happen. And that came to me, even though I wasn't in a mental state to do it. And Aaron's family was, right down the hall, in the waiting room, and could have been a kind of bridge between that for me, even though maybe I had to make the ultimate decision, but they could have held my hand and walked me through it. And so that part of it felt like I was there to be a caretaker, but I was in no position to take care of anyone. And so yeah, I didn't feel that part at all. And so please keep in mind that we're in a fragile state as well.
Yeah. So to give the healthcare providers, a little bit of time to talk about this, how, Catherine and Caroline, can you share how you approach providing care to the non-birthing partners?
Yeah, I appreciate the stories. I think sometimes I have difficulty approaching the non-birthing parents. One thing that I usually try to do is make sure that they're fed and sleeping. I feel like most of the time, kind of like Alex and Tom said, your priority yourself, where their priority is on their spouse or their partner or, the mother of their child and the baby, and they aren't taking the time to care for themselves. And, I'll ask, did you eat today? Has anyone ordered breakfast? And it's usually the father will say, oh yeah, she ordered breakfast and they brought it in a half hour ago, but he's not telling me if he ate or, did anybody bring him water or, kind of telling me, oh yeah, she was able to sleep through the night, but not answering about themselves. And I think that so much of the focus from the healthcare perspective is on the person who's delivering, that the partner often kind of puts the focus on them as well. One thing that I will try to do a lot of times, kind of like we talked about earlier, welcoming other family members or friends into the hospital to support you or to meet their grandchild or their sibling. I feel like a lot of times we ask mom, like, who do you want to be here? And I'll try to remember to include dad and ask, the partner or the father, is your family around? Or do you want us to call anyone for you? Who do you want to be here? Because it's their child as well. So I'll try to incorporate them in that way. I would say recently I've tried to find more supports for parents, not just the birthing parent. Pockets of Light, in my experience, one of the only support groups for both parents. There's a lot of resources out there for women who experience a loss, but there's really not that much out there for dads or for the non-birthing parent. So that's something I've tried to expand the resources that we provide, but unfortunately there's really not that much out there yet for dads or for the non-birthing parent.
Real quick, I do want to mention Hudson Shea Foundation, and Caroline, I can share this with you. I don't know if you have them on your list, but they do provide support just for men. And actually, I mean, the founder of the organization is on our board, and they have been around for many years now, and I know a lot of people that have benefited from their services. So if you don't have that information, I can share it with you.
Yeah, that would be great. Thank you.
I agree. I think that it can be hard for healthcare professionals or people in general to remember that this is more than just the birthing person's experience. The way I like to think about it and the way that I was luckily trained as a new nurse was in the hospital, they have us. And then you guys go home and you have each other. And you both need to be prepared to be there for each other in whatever way that may be. And in terms of what we do in the hospital, or what I've learned to do in the hospital, to include non-birthing parents, especially right after delivery, is having the father or the non-birthing parent help me get footprints, help me bathe the baby, help me cut the lock of hair, and those memories that we were talking about before. And, you know, when we deliver a live baby, we often do involve those non-birthing parents in those ways. So to include them on the flip side, I think is super important. And I have felt a great impact, and I've felt that gratitude. And I actually get chills talking about it because I had a non-birthing parent tell me, you know, can you include me? And I was taken aback by it, but I appreciated the transparency. And I was like, absolutely. I assumed for whatever reason that they didn't want to be involved in these things. But it makes such an impact. And I think that in what I was talking about before with the therapeutic space, giving them coffee, tea, of course, that should be our bare minimum. And I think that I really appreciate the transparency in what you guys need, because that's the only way that we can improve.
Absolutely. Okay, this question is for Tom and Gigi. What's one thing you'd like to tell healthcare providers who have less experience treating perinatal loss patients?
So I think it was Chloe that touched on it earlier about trying to figure out where they are and what they need. I think because you don't have as much experience, just making sure that you're over communicating is going to be really important. Because for me, feeling like I'm your top priority, like I'm the only delivering parent family right now on the floor, is important. And I think that would really cover a lot of bases, even if there's a checklist that, you know, as a hospital you have to go through and you're not really sure if this is the time or not. But if you over communicate with the family, I think you will be able to better meet our needs in a lot more time, like, you know, in a shorter period of time, or at least touch base with a lot of what we need. And it won't, I don't think even it's going to be a thought for us, oh, how long has she been working? Why is she asking me these questions? I think we're just going to love the fact that you're catering to us and asking us what we need. And sometimes it's more about the confidence in it versus the level of experience that at that time works best for us. Our nurse stayed, I mean, and I know you can't always do this, but the consistency that was mentioned earlier was important for us. Our nurse stayed with us the entire time. I don't know what mountain she had to move to make that happen, but it was so much easier, especially for my husband, not having to repeat over and over, because I was in shock, obviously, and I'm thinking the same thing. Who do I have to break the news to? Oh my goodness, what are we gonna do? But it's definitely important for us to see you, and you're the one checking on us, breakfast, lunch, dinner. You're the one coming in with the updates. You're the one introducing us to the new face that has to come into the room. That is, I think, more important than experience. So, I mean, you might have to get comfortable stopping in every time there's an experience. I mean, 10 times in a month, I was shocked by that stat, but I'm not really truly surprised, but still like, wow, that's a lot. We're still having a lot of loss happen. So maybe making yourself available whenever you're on shift to stop in and check in so that you'll be more comfortable over time with what should be done or what some steps are that would be helpful.
Yeah, I mean, I think the biggest piece of advice I could give is to try to slow down a little bit. I know you all are all extremely busy, probably overworked and definitely overstressed, and it's very hard to think about the list of stuff that you have to do on any day, right? It's long, and just remembering that when you're dealing with these people, you're dealing with them on their worst day of their life, and make sure that they feel like it's not just another day in your life. I think Melissa, you mentioned your doctor said it was one of the worst days of her life, right? You don't have to say those exact words, but just make us feel like you feel it, right? Show a little empathy. Take a second to sit in silence with us, hold our hand, just slow down a little bit. And I think, Catherine, you said it a lot. Like, try to read the room, right? Try to read and see what we need rather than just doing what you have to do. Make sure you're checking to see what your patients need. That's the most important, like, thing. It's just how you approach it, right? There's no one thing, just how you approach the whole trauma, right? Is slowing down a little bit and trying to have a little empathy. And I think, Dr. Phillips, you were mentioning one thing about, sometimes there are no words when you're sitting with patients there. There are never words. That's an important thing for all of you guys here. There are never any words that will fix the situation. And if you're trying to use words to do it, you're more likely going to cause trauma than help, because you're going to say something that, even though you think it makes sense, it will not make sense to every bereaved parent. And so the best thing to do is just sit with them in their trauma and like kind of let them lead the way, rather than trying to push words to try to fix the situation, because there's nothing that you can say that will help.
No.
As Tom's talking, I remember that our nurse, she called our baby's name. She said Avery. She didn't say, oh, baby, or, it wasn't chemical. It wasn't sterile. It was warm. Have you thought about Avery today? Have you thought about maybe holding Avery right now? Do you want to lay Avery back in the cot? Things like that. We're getting ready to do Avery's footprints, or the photographer's coming in now for Avery. And that was helpful, because our baby does have a name. Most families, by as far along as we were, have already had a name. So I think that's also something that would go the distance for sure.
Yeah. I think one of our facilitators is a nurse, and she helps with trainings a lot. And one of the things she always says is like, she suggests that, nurses treat the babies that have passed the same as they would be treating the living babies, right? So offering the same things and calling them by their name and doing all those extra little things, goes a long way and shows a lot of compassion. So our last question is for Chloe. What is one thing you'd like lost parents to know?
I think the biggest thing is like, we're here to serve you. We're here to meet your needs. And I think one of the hardest things is that, like, this isn't something that comes in a manual. It's not like, we're talking about what happens if you're the person that experiences a loss or a stillbirth. So you come into these situations, and like we've touched on before, you don't know what to ask. You don't know what's acceptable / what you'll miss out on doing in the days and weeks and years coming, that you'll wish that you did something. So ask. I know that that's hard, and that puts a lot of onus on the person too, to have to be the one to ask for something. But I know that though we try our hardest, we don't always get it right. We're not perfect, and we are trying our best, but if we know what's like that thing that will make a difference, or that thing that there's no silly question, there's no wrong place or time. Ask, can you hold the baby? I mean, the answer and to the question of what's something that a parent or patient asked you that made you uncomfortable, or that you didn't know what to do with. There's so many times where we didn't know what to do or how to manage that situation, but we just troubleshoot. We figure out what we can do in that moment that can best help the person and their family, and make it happen for them. Like, we will break down walls for our patients to make it so that their experience and what they need in that moment gets done. So,
Well, thank you very much. And thank you all for sharing tonight. I think, like I said, hearing from both sides and hearing the perspectives of all of, our different panelists is so beneficial to everyone. I just think this conversation is so helpful for everyone listening. And Kelly, thank you so much for reaching out about this again and making this happen.
Thank you so much.
And I just want to share that the feedback that we get in our groups, specifically on Cooperman-Barnabas and the care that people receive and the support they receive while they're in the hospital, has gotten extremely positive. I mean, it's really become a theme. Anytime anyone says they delivered at Copeland and Barnabas, I mean, I just want you all to know that you are doing such a good job of caring for your patients, because we hear it over and over and over again. We had a candlelight memorial service last week, and somebody was talking about you all. And so I just want to make sure that you know that, and that what you're doing is making a difference. So.
Thank you so much. Thank you, everyone. We'll be sharing this video. And I just can't thank you all enough for sharing your experiences and your thoughts. And it's just so very much appreciated. So thank you.
All right. Well, thank you. Good night, everyone.
Good night.
Bye.
Bye.